my 12 safety practices are verify care/order for the client, perform hand hygiene before and after any client care and assembling any supplies, verify faculty policy and procedure and assemble required supplies and equipment, consult manufacturer recommendation when any equipment is used, knock on patient door, identify patient using 2 forms of identification, note overall care of the patient, explain the procedure to them and provide privacy, elevate the bed to promote good body mechanics, don PPE if indicated, upon completion, lower the bed, raise the side rails according to the care plan, and make sure that their calling system is within reach. If any abnormal findings are present, notify the charge nurse immediately. So today we're going to be doing a sterile dressing change. Prior to this, if this is going to be a painful procedure for your patient, you want to medicate them 30 minutes prior. And whenever you're medicating a patient, you want to make sure that you're using the 6 medication rights, which are right drug, right dose, right time, right route, right patient, and right documentation. So now that we have medicated the patient, knock on the patient door, identify them using 2 forms of identification, explain the procedure, and now we're going to remove the dressing. So when you're removing the dressing and you're removing the skin or the tape off the skin, you want to use some traction just so that it's a little bit less painful for them. Also for the scenario, we're going to pretend that the head of the bed is over here. So you want to remove the dressing in a direction to where the patient can't see it. And the reason for that is they may not like the sight of blood and they may get wheezy or whatnot. So you're going to remove the dressing and we're going to remove the packing. So first you're going to assess the dressing itself and the packing. So you want to see if there's any drainage present. And if so, what about it? How much is there? Is there a significant amount to where we need to weigh it? What color is it? Is it serous sanguineous? Is it purulent? Is there a sign of infection? And is there any apparent odor? So after you assess the dressing, you can discard it. Just roll it in your gloves. Again, verify your faculty policy and for your procedures. To note where you need to discard this. Does it need to go in the biohazard, or if you can just simply put it in the trash. So for now, we're just going to put it in the trash. So now you're going to assess the wound itself. Just looking at it, are there any drains present? Any Jackson Pratt, Hemovac, Pennyrose's, and looking at the skin tissue, is there any slough, any eschar, any granulation tissue, and then also what kind of wound is it? Is it a pressure wound? Is it a surgical wound? Is it full thickness, partial thickness? And then we also want to measure it as well. So we have a measuring device here, as well as some cotton tip applicators. So you want to measure length times width times height or depth, and you also want to look for tunneling and undermining. So when you're measuring, you want to make sure that you're using the correct units and that they're the same as people in the past have used with this patient, just so that everything is on the same page. So for length, you just measure the length from the head down, and then width, and then for height or depth, this is when you're going to use your cotton tip applicators. So you just take one out, and then you're going to feel around for the deepest part of the wound. Once you've found it, you can use your thumb to mark it, and then usually the packaging that the cotton tip applicators come in, they have a little ruler on the side, so you can just use that to measure it. You can discard this one. And then you want to check for undermining and tunneling. So just feel around. Again, this is the head of the bed in this scenario. You can use the clock system, 12 o'clock, 3 o'clock, 6 o'clock, to document the placement of the undermining and tunneling, if there is any, and also the depth of it. So you want to, again, measure, use your thumb to mark it, and measure the length or depth of it. So you just discard that. Now what you want to do is check the peri wound, so the skin around the wound. So just looking at it, is there any erythema? Is there any edema? Any ecchymosis around there? Any obvious draining or drainage from the outside? Is there any apparent odor? You also want to touch it gently with the back of your hand to assess for any warmth, which could be a sign of a fever, infection. And while you're doing this, you want to assess your patient and see how they're tolerating this, if this is causing them any pain or any discomfort. So once you've assessed the wound, you want to document all of that. So now we're ready to get our sterile field ready. But before you open your sterile field, you want to make sure that you have everything that you need prior to doing that. So first what I'm going to do is get tape and a pen, and you want to measure your wound to get 3 pieces of tape, and you also want to write your initial date and time on a little piece of tape. That way when you're done, you can put it on there. I have done so, and I have my tape right here. You want to make sure that when you do measure the tape, that you don't want it to be too long, because that could be painful for the patient when they take it off in the future. And also, I have a little piece of tape I'm using as a barrier. That way I'm not using the tape that I'm putting on the patient directly on my side table. So I also have some 4x4 gauze, and I also have some normal saline. So now that I have everything that I need, I'm ready to open up my sterile field. I'm going to open this away to the side and towards me. So just because this table doesn't come out all the way, this should never go below. But this is just what we have right now. So I just want to clarify that this would not go below, because you don't want to contaminate your sterile field. At any point when you have a sterile field, you want to make sure that you're doing things to contaminate it as less as possible. But you are going to have to go in there and get things, and you are going to have to put things in there. So right now my sterile gloves are in there, so I do need to get them out, which is okay. I just need to enter at the least point of entry. So there's a little spot right here. I'm just going to slip my hand in and grab my gloves and put them on the side for now. I'm also going to put in some 4x4 gauze. Most packs have them, but I'm just going to put some more in. So again, you want to stay as sterile as possible. So you're going to open away, and you're going to toss them in at the least point of entry. Okay, and just set that aside. I also need to add some normal saline, which is the cleanser for this procedure. You always want to make sure that you have the right cleanser. Not every procedure is going to have normal saline. So this is normal saline, and you want to make sure that it's not expired. So this says it expires June of 2023, so we're good. You want to place the label in your palm, and again, when I put it into my sterile field, I want to enter at the point of entry where it's going to be least contaminated. So I see a spot right here. I'm just going to pour it in and then set this aside. And then I'm just going to pull this sterile field over here just a little bit. So now I'm ready to put my sterile gloves on. You want to make sure that you have enough room, that you don't overlap your sterile glove packaging with your sterile field packaging. Again, I just want to note that this should not be lowered. This is what we have right now. Okay, so now I'm going to put on my sterile gloves. So I'm going to open my packaging using my 1-inch border that I can touch. So I'm going to take my left hand and I'm going to pinch the cuff of the right glove, okay? I'm going to lift it, making sure not to go above my shoulders, and I'm going to stick my hand in and pull down. This is still cuffed. Once I put my other sterile glove on, I can fix that, but for now I'm just going to leave it. Now I'm going to take my right hand and cuff the left glove, rising it up, but not too far to where I'm going above my shoulders, and sticking my hand in. And now I have my sterile gloves on. Now I can fix this. So now I have my sterile gloves on. I want to make sure that I stay in a sterile zone, meaning I don't go above my shoulders and I don't go below my waist. So now I'm ready to cleanse the wound. Normally, the bed of the patient would be at my waist level, just to ensure that I don't leave my sterile zone. But for this purpose, this table is a little bit lower, but we are going to pretend that it is at my waist level. So now I'm going to cleanse the wound. So first what I'm going to do is get a piece of 4x4 gauze, and I'm going to wet it in my normal saline. So I'm going to enter my sterile field, grab a 4x4 gauze, get it wet, and now I'm gonna go and clean my wound. Keep in mind that you don't want your gloves to touch the wound at any point because that will contaminate your gloves. And also you wanna start from least contamination and go from most contaminated. So the least contaminated part of the wound is going to be the center of the wound. So I'm gonna take this and I'm gonna go, this is gonna be the head of the patient. You wanna go in a downward stroke, down the middle, in one stroke. Never reuse this gauze, never reuse this gauze. Once you've used it, you need to discard it. Again, you don't want to lower your hands below your waist, so don't throw it in the normal trash can. What works is just using your sterile glove packaging because you know that it's at waist level, it's in your sterile field. So I'm just gonna toss that in there just as so. So for this purpose, we're gonna cleanse it 3 times. So I'm gonna reach in here again, grab a gauze, get it wet, and now I'm gonna clean each side. Again, making sure that my hands don't go below my waist, and I'm making sure that my gloves, my sterile gloves, do not touch the wound, okay? So here's another stroke. I'm gonna discard it, making sure not to lower my hands. And then one last time. And then I'm going to cleanse it again. 1 stroke, making sure that my gloves do not touch the wound and my hands do not go below my waist, and I'm gonna discard that. So now it's time to pack the wound. I'm gonna get a piece of gauze wet in my normal saline and I'm gonna fluff it out, okay? I'm also gonna grab my 2 cotton tip applicators that are in here to help me pack the wound. So I'm gonna come over here, place it in my wound, making sure my gloves do not touch the wound. That's why I have these cotton tip applicators to help me. So you wanna pack your wound using these. You wanna make sure that you have enough packaging in there, but you don't wanna have too much. You don't want it to overlap on the skin because that could cause maceration and you don't want that. So once I've packed my wound with my wet gauze, I can now discard these cotton tip applicators. And now I need 2 4x4s that are dry to place over my wound. So I have my 2 4x4s, my dry ones, and I'm gonna place over the wound. And now I can apply my ABD pad. I'm just gonna reach into my sterile field to grab my ABD pad. The ABD pads have a blue flap on it that helps you grab it, and that also notifies that that's the top blue, the sky, so that should go on top. And you're just gonna place that over the wound. Once you place it over the wound, you no longer need to be sterile, but I'm gonna keep my gloves on anyways. Now I can place the tape over my wound. And I'm just gonna use the 3 pieces of tape. And I also have my initial date and time tape as well that I'm going to put on here. Once you are complete, you ask the patient how they tolerated it, if they need anything, and make sure you document everything. And you're done.